Dr. Tracy Page, and welcome to Health Made Easy, where we discuss topics focused on hormonal health, weight loss, and wellness. Yes, you heard me. I want to make being healthier easier. Don't get me wrong, we all have to do the work, myself included, but let's make being healthy less complicated. I'll provide clear, simple, and actionable steps that you can implement into your daily life. Really, who doesn't want to feel better? If you're ready to increase your energy, optimize your well-being, and restore your health, then listen up. I love helping my patients and listeners optimize their health and clear away the brain fog, shed the excess weight, improve their mood, and really change the way they age. I am a triple board certified physician, and I created Health Made Easy just for you. Let's get started on today's topic. Welcome to episode number 16. Today I want to talk to you about the silent killer known as blood pressure. So we don't really think about blood pressure as a silent killer, but it really is. And I really want you to know about it. I want you to understand why we check your blood pressure every time you come to the office. And it's a really important vital sign that tells us a lot about your health. And you may not think about it, you may not consider it important, but today, after listening to this podcast, I really hope that you'll pay attention to what's going on with your blood pressure. So today we're going to talk about high blood pressure, why it's so important, and you'll learn what it is, what normal pressure is, why you should even care about your blood pressure, what causes high blood pressure, and how you can prevent high blood pressure and reverse it. You may not know this, but high blood pressure is known as a silent killer. And according to the American Heart Association, high blood pressure affects nearly half of all adults in America. And why it's so prevalent is because it's the silent killer. You don't always have symptoms when you have high blood pressure. And so many people are walking around without even realizing that their pressure is too high until it's too late. And I don't want it to be too late for you. So I want you to be aware of it now. So let's talk about how do you get high blood pressure and what exactly is it? To understand high blood pressure, you really have to understand the relationship between your heart, your blood vessels, your blood flow, and your body. So your blood circulates via the body in our blood vessels. You think of them as your arteries and your veins. And then we have our heart, and think of it as kind of like the motor or the pump that moves this blood through our circulation, which is our blood vessels, and allows our blood to circulate. And our blood carries oxygen and other essential nutrients throughout our body. So we don't think about it, but when we breathe in air in our lungs, and that lungs has oxygenated blood, and our blood has oxygen, and our blood has to come through there to get oxygenated. And then we have to carry all that blood through our body to make sure that our limbs are getting oxygen and the proper nutrients that they need. Your blood pressure is the force that your heart has to pump and the force the blood puts on your blood vessels as it circulates throughout your body. So you can imagine, think of a balloon. So if you fill a balloon full of water, it stretches, it has a lot of elasticity, has room to grow until at some point it gets so full that the balloon pops. Versus a hose that's very rigid and it's very stiff. So you fill it full of water and only so much water can get in, and it doesn't change in size unless it's one of those expandable hoses, but it doesn't change in size. And so it's going to take more pressure to get that water through that hose that's stiff and thick than it is to pressure to fill up that balloon that expands and absorbs all that fluid that comes in. Okay. So it's kind of hard for you to picture, but there are problems when your vessels get stiff and hard. It creates more pressure, and the more pressure, it creates more work on the heart to get that blood circulating through our system. So there are two numbers that we look at that we're concerned about when we look at your blood pressure. And the first one is your systolic blood pressure, and the second one is your diastolic blood pressure. The systolic blood pressure is the amount of pressure that your blood puts on your arteries as it circulates. So it's the amount of pressure your blood puts on your arteries as it circulates. So if there is more blood, if there's more fluid, if there's more, so let's say you eat a lot of salt and you retain a lot of fluid and then you have more volume, you're going to put more pressure on your arteries. The diastolic blood pressure is the amount of pressure between the beats of your heart when the muscle relax. We read both your pressures, your systolic and your diastolic. And the American College of Cardiology defines a normal blood pressure with a systolic of 120 and a diastolic of 80 millimeters of mercury. And, I honestly think that number may have gone up. And I don't think it went up for a good reason. I actually think it might have went up because we've been seeing higher blood pressures, just like we see higher weights. Like we have more higher basic weight in society than we have had in years. And the same thing, we're seeing higher blood pressures. But historically, we always said a normal blood pressure was 120 over 80. And our blood pressure does change, and it's meant to change throughout the day. So a perfect example is if you go for a run, your blood pressure is going to go up and your body's going to expect that, but then it's going to come back down. So it's normal for it to increase when we exercise. Your heart's working harder. You have to get more blood and oxygen to your muscles that you're relying on, like if you're running or rowing or doing something. And it will go back down once you're done. And actually that's a sign of good health. Like if your heart rate and your blood pressures come down right after you exercise, that's a really good sign. Especially if you drop like 20 points in your heart rate right after you finish exercising, it's a really good sign that you're healthy. Our blood pressure is not meant to stay up consistently high at a high level over long periods of time. And when it does, that's what we call hypertension or high blood pressure. So, why do we care about it? Well, you kind of probably already are starting to figure out why we would care about your blood pressure. But let's just kind of go over some of the things you may not know. That there is a direct correlation between high blood pressure and chronic disease. And that hypertension is the most common preventable risk factor for cardiovascular disease. It's a huge, huge predictor of how healthy you are. And when you have uncontrolled high blood pressure, it can lead to damage to your arteries. It overworks your heart. Your heart has to especially work hard to pump the blood through the arteries when you have hypertension. So when your blood pressure stays up high like that, it leads to heart attacks, where part of the muscle can die and stop working. It leads to strokes, where the blood vessel ruptures and causes a bleed in the brain. They call that a hemorrhagic stroke. It can also lead to aneurysms. So you may have heard, different people. I can't think of I'm not really a TV watcher, but there's a celebrity. I was thinking he was playing hockey, and he had an abdominal aneurysm. So I've seen this a couple of times where someone will have an abdominal aneurysm, and so it will just burst, and that's the aorta is. It carries all of our blood, such a huge part of our blood. And so you have the abdominal aorta, which carries the blood from the upper body to the lower body and then bifurcates. And so they'll have a rupture. And, it's very hard to live after you have an aneurysm, whether it happens in the brain or happens in the abdomen. So when you have chronic high blood pressure, all of these things can happen. And I don't want to sound like doom and gloom, but I think it's important to know, that this is one of the number one preventable things that you can reverse. So what causes high blood pressure? So unfortunately, our genetics do play a role, but there are things like lifestyle factors that play a role and are just as important. So if a patient is genetically predisposed to have high blood pressure, maybe you had a family member who had it, who has a history of hypertension or runs in the family, then you are more likely to develop it. But I will tell you, and I say this to all my patients, is that you are not your genes. You are born with your genes, but what kind of environment you put them in, epigenetics determines how they present. So if you watch your lifestyle factors, even though you may have a propensity to have hypertension, you may never get it. Or if you get it, you can reverse it. In my family, my father had diabetes and hypertension. I have a sister who has diabetes, and I started to have elevated blood sugar. I've never had hypertension. And so that was my epigenetics. That was my wake up call to say, hey, my family, my genetic pool has it. But if I don't want to have it, I better start making some lifestyle changes. And the same goes for hypertension. So when you have high blood pressure, what can you do? So, one, you're genetically predisposed, but let's also talk about the other things that cause you to have high blood pressure. So, it's caused by stiffening of the arteries. We talked about that. So, as we get older, our arteries actually stiffen and lose their elasticity. So I use that balloon example. So when you put fluid or air in the balloon, it stretches and stretches and stretches until it pops, right? But it has still a lot of elasticity. There's a lot of space and room in that balloon before it ever pops. And that's kind of how our arteries start out. They have lots of elasticity. They can handle high volumes, but as we get older, they become stiff and they lose that elasticity, and therefore they require more pressure to get the blood through the arteries. So again, I said lifestyle choices play a major role and they contribute to hypertension. And luckily, these are all controllable. So doesn't mean it's easy. But again, we learned earlier that life is hard. 50% of the time it can be hard, and that's okay because that's what makes us better. So high salt diets, alcohol consumption, physical inactivity, being overweight, and even medications can cause you to have high blood pressure. So let's talk about ways we want to prevent it. So we talked about all the ways that it can occur and what happens if it does. So you can't change your genetics, like we talked about. You can change your epigenetics, which is your environment, which is what you put your genes in. And you can change the way you age by your lifestyle choices. And all of those things will minimize your risk of developing hypertension. So I want you to focus on the following things. If you're a person who has elevated blood pressure, if your pressure routinely is over 120 over 80, so it's higher than that number, then you really have to look at these things. You want to look at your weight, you want to look at your salt intake, you want to look at your diet, you want to look at your alcohol intake, also your physical activity, and we're going to talk about each one of those. So when you're talking about maintain a healthy weight, I talk about this a lot on the podcast because it's so important. It affects every area of your life. Studies show that a decrease in body weight directly correlates with a decrease in blood pressure. And I can't tell you how many patients come in to me and they say, I want to get off my blood pressure medication. I want to get off my diabetes medication. I want to get off this medication, that medication. But they never talk to me. Sometimes they never talk to me about weight. And then they kind of have weight listed last. And I'm like, did you know if you took care of the weight issue, that all of these other issues that you want that are happening will all go away? They'll just fall away. And we do know that if you reduce your weight, you decrease your blood pressure. So you want to eat for a calorie deficit, regardless of the diet that you choose. I mean, there are so many diets out there. I don't think there's one better than the other. Well, let me rephrase that. I think there are some that are better than the other, but I think the bottom line is you have to find what works for you. And we work with our patients to do that. But you do have to have some type of calorie deficit so that you tap into your fat cells. So if you always eat based on what your body needs to sustain itself, muscles, the food that you digest and your basic metabolic rate, I include them all, then you won't lose weight. But if you do have a calorie deficit and you increase your physical activity, you will lose weight. So once your organs are fed, once your muscles are fed, anything else that has excess that you're eating is just going to your fat cells. You want to increase your activity, so aim for quality movement every single day. And it doesn't mean that you have to go out for a run or bike or do a class. It just means go for a walk, get your steps in. Don't take the elevator, take the stairs, park further away from the door, find ways to be active. But you want to increase your activity. And, I've seen many of my patients lose weight just by walking. It costs absolutely nothing. And you can do it virtually anywhere. So I always encourage my patients to get started on a walking program first. Remember to always aim for gradual lifestyle changes. And I think this is an important thing to reiterate because when it comes to your diet and it comes to exercise, quick fixes are just not going to do it. You're going to have to make lifestyle changes, and it's better to make one change. And if you haven't listened, go back and listen to my podcast on habits, but it's better to start one habit, start one change, start working on it, and then once you've mastered it, then add another one. And give yourself something that you can definitely accomplish. Remember that it's really all about balance. It really is. What does salt have to do with your blood pressure? So, I like Himalayan pink salt. I don't really salt my food, but I do add salt once in a while when it calls for it in a recipe. But we know that excessive salt intake is linked to hypertension because sodium increases water retention. So we already know that. Ways to decrease your salt intake is basically just to pass on a salt shaker. You want to maybe flavor your foods with herbs and spices. You could use a salt substitute and make sure you really read the labels on your foods because a lot of processed foods have a lot of sodium in them. So I always tell my patients to be very aware of the salt shaker and the salt. You also want to increase your vegetables and fruit consumption. So I always tell my patients eat the rainbow, make sure you're getting all different kinds of colors in the rainbow, but why fruits and vegetables for blood pressure? Like, did you ever wonder why? And one of the reasons why is because they carry a lot of potassium in them. And potassium has exactly the opposite effect of sodium. So, sodium makes you retain water, and potassium makes you lose water. So, it helps balance out that sodium intake. But here's the thing, you shouldn't just start taking potassium because potassium can affect the rhythm of your heart. So, you have to be very careful. So, don't go out and get supplements of potassium. And that's why I always say this is a podcast for educational purposes only, not for diagnosis and treatment. And so, but I do want you to know that your fruits and vegetables have a lot of potassium in them. And so they are going to help bring your blood pressure down. Fruits and vegetables that I really emphasize in my patients are those who are not insulin resistant, bananas. So if they don't have a blood glucose sugar problems, I do bananas, spinach, oranges, pumpkins, and sweet potatoes. So all of those are very high in potassium. But most importantly, like I always say, eat the rainbow. So eat all kinds because there's not one that's better than the other. They all do different things. There is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. And some of my patients follow the DASH diet. I know a lot of cardiologists recommend the DASH diet. So the DASH diet is specifically made to help bring down blood pressure and it's, balanced healthy meals. So it's really focused on low sodium food intake. Now, what does alcohol have to do with blood pressure? And actually, when I was thinking about this topic, I did a little bit additional reading and I was kind of surprised about alcohol. Like I said, I've never been a big drinker. I know people who drink and they drink pretty regularly. And so this kind of surprised me and also made me a little concerned for them. But you may not know this, but alcohol does cause inflammation in the body, which has been shown to directly relate to increased blood pressure readings. And remember that drinking in moderation, which we don't really think about, but moderation is limiting yourself to one if you're a woman or two drinks if you're a man once a day. And to me, honestly, that still sounds like a lot. Remember that a serving is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of some type of 80 proof distilled spirit. So I think of that like Tito's or whiskey or something. The studies have shown that binge drinking is defined as 4 or more drinks within 2 hours for women and 5 or more drinks within 2 hours for men, which has been shown to correlate directly with hypertension. And heavy drinking is more than 3 drinks a day for women and for men. And heavy drinkers who cut back to moderate drinking lower their top systolic number by 5.5. So they may go from 135 to 130. And then their bottom diastolic number drops by 4 points. So it might be 90 and it goes to 86. So, alcohol really does affect our blood pressure. And so you may want to keep that in mind. And I'm not against drinking. Like I said, I grew up in a household where we didn't really drink, or we didn't drink at all. So I didn't really get exposed to drinking until I was older as an adult. And, a drink every now and then is nice. I like to have one just like anyone else. But if you have high blood pressure, then you really want to think about the alcohol consumption. Finally, I'm going to say is stay active. I always say to my patients that movement is medicine. And I truly believe that. Exercise in our culture doesn't just happen. We have to take charge. We have to make fitness a priority. We have to make choices that allow us to make fitness a priority. So, and we know that even moderate intense physical activity, such as a brisk walk, is beneficial if it's done regularly. So again, it always goes back to it doesn't have to be hard. It doesn't have to be complicated. It just has to be consistent. And in our pause program, when we work on weight loss, we always talk about consistently good far outweighs being, occasionally perfect. So you might have one day where you're perfect and you get your 10,000 steps in, or you run 3 to 5 miles. But if you only do that once every so often, it's not really going to help you. I'd much rather you get 5,000 steps in, 7 days a week and get some consistent exercise. So the guidelines are that most people should get in about 150 minutes, which is 2 hours and 30 minutes of exercise per week. I like to break it down to 30 minutes, 5 days a week. So, 5 days a week, you have to move your body at least 30 minutes. And that is also up on our wall I talked about that in another podcast, but we have this great kind of, when you walk into our clinic space, we have this wall. And one of the things it says is love your body. And it's another thing on there. It says move daily, hydrate often, sleep lots. So eat well, all those things they seem so hard, but yet they could be so simple if we just try to keep them simple. So move your body daily. And 30 minutes is not a lot to ask. 30 minutes out of your day. It's less than 2% of 24 hours. We know that movement decreases or is an anti-inflammatory effect on your sympathetic nervous system. And so we think of our sympathetic nervous system as our fight or flight system. So remember that when you move and exercise, you are affecting that system and bringing your blood pressure down and reducing your risk of hypertension and hypertension associated diseases. You always want to remember, do exercise that you enjoy. So always my patients ask me, what's the best exercise to do? And I always say the one you enjoy, because you'll show up and you'll do it. And there'll be times in your life when you enjoy something more than the other, and then you'll switch and you'll like something else. I do this all the time. Like I'll love bar class and I'll go to bar class and then I'll be like, oh, I really want to hit the weights hard. So then I'll get into weightlifting and I'll be like, oh, I like to run. So then I'll get into running. I like to change it up. It keeps me interested and motivated. It keeps my body interested and changing. So start something. That's the most important thing. Start something. And then if you don't like it, it's okay to say, hey, I don't really like it. I'm going to go over here and try yoga, or I'm going to go over here and try swimming, or I'm going to get on the elliptical trainer and try something else. So don't be afraid to try something else. The most important thing is that you move 30 minutes, 5 days a week. All right. Remember to have your blood pressure checked periodically, especially if you're at an increased risk for hypertension. So all of these things we talked about, if there are other family members that have high blood pressure and you haven't been getting yours checked regularly, make sure that you do that. Remember, as you age, you increase your risk for developing high blood pressure because our vessels become stiff. If you have a family member, you have an increased risk. And if you have chronic disease, like other diseases like diabetes, again, you have an increased risk. Or if you have excess weight, you have an increased risk. So make sure that if you do have an increased risk, that you're getting your blood pressure checked regularly. You don't want to be a victim of a silent killer. I mean, you could be walking around with hypertension and not know it until you have a devastating event, which we don't want to see happen. So I hope you'll take this podcast seriously. You'll know what your blood pressure is. Remember, there's a systolic number on top and a diastolic number on the bottom. They're both important. Make sure you know what yours is. Make sure you get it checked regularly, and make sure you implement some of the things I talked about that you can do in order to decrease your blood pressure if you do have high blood pressure. So watch your salt intake, maintain a healthy weight, reduce your alcohol intake, increase your vegetables and fruits, and again, stay active as much as possible. I'm wishing you a healthy blood pressure and an amazing day. Take care. This is an important reminder. The podcast is for educational purposes only and is not a diagnosis or a prescription for care. Please consult with your healthcare practitioner before moving forward with any of the therapies or treatments discussed in today's podcast. If today's topic resonated with you and you want more information, please check out our website, wisconsinfunctionalmed.com. All one word, wisconsinfunctionalmed.com. Also, for those of you who want further assistance with weight loss, consider our online weight loss program called The Pause, which can be found under services. We really focus on helping you reach your weight loss goals. We provide a supportive and interactive and engaging environment, which is led by me, Dr. Tracy Page, so you can get all the help you need. Remember, you can change the way you age, and I'm here to help.